What if I told you that one single plant could be a life-saving medicine, a risky drug, and a billion-dollar business all at the very same time? Well, that's the huge paradox of cannabis, isn't it? Some places see it as a treatment, others see it as a threat. So what does the science actually say? Okay, let's dive in and find out. This is the big question we're going to tackle today. Can one plant really wear all these different hats? The answer, as you might guess, is a lot more complicated than a simple yes or no. And it all comes down to understanding what this plant is and how it really interacts with our bodies. So, to really get to the truth, we have to start with the basics. First up, the plant and the body. Let's break down the fundamental science of what's going on here. At its heart, cannabis, or weed, whatever you want to call it, is a plant. It's filled with active chemicals called cannabinoids. And right away, here's the first crucial point. Just because something is natural, that does not automatically mean it's safe. I mean, poison ivy is natural too, right? The real power of this plant is all in its chemistry. The two most famous of these chemicals are THC and CBD. Think of them like two totally different characters in the same story. THC is the one that's psychoactive. It's what causes the high. CBD, on the other hand, is non-psychoactive. It's the compound that's most often studied and used for medical treatments. So you see, not all cannabis is the same. So why do these chemicals from a plant even affect us? Well, it's because our bodies are actually pre-wired to interact with them. We have this built-in network called the endocannabinoid system. It's a really complex cell signaling system that scientists only discovered back in the early 1990s. And this system is a huge deal. It helps regulate so many critical functions, like how we feel pain, our mood, our sleep, our appetite, even our memory. So when someone uses cannabis, the plant's chemicals come in and interact with this system. And that's exactly why its effects can be so incredibly wide-ranging, from helping with pain to affecting how we remember things. Okay, so let's move on to the central conflict here: medicine versus risk. This is where we have to weigh the scientific evidence, looking at both the benefits and the potential harm. Now, on the medicine side of the coin, the evidence is pretty clear for some very specific conditions. Science has shown that cannabis-based treatments can be really effective for chronic pain, for managing that awful nausea that comes with cancer treatments, for reducing seizures in certain rare types of epilepsy, and for easing muscle stiffness in people with MS. But, and this is so important, medical cannabis isn't just someone deciding to self-medicate. It's a prescribed treatment that is controlled and measured for purity and dose. You know, it's like antibiotics. You wouldn't just take a random handful without a doctor's prescription, would you? The exact same logic applies here. But for every potential benefit, there is a risk. Short-term, using cannabis can lead to poor memory and bad judgment. For some people, it can even trigger anxiety or full-blown panic attacks. Long-term, there's a very real risk of addiction. And, this is a big one, it can damage the developing brain, especially in teenagers whose brains are still a work in progress. Yeah, the science is really, really clear that certain groups are at a much higher risk for bad outcomes. That's why cannabis just isn't for everyone. Pregnant women, teenagers, and anyone with a personal or family history of mental illness, like psychosis, they are all strongly advised to avoid it completely. This all brings us to a much bigger question, doesn't it? Let's zoom out and look at the social and personal verdict. Legal versus safe. Just because something is allowed by law, does that really mean it's harmless? You see, many countries and states are legalizing cannabis, and it's not a random decision. The main reasons are actually pretty practical. Legalization lets governments control the quality and safety of the product. It helps weaken illegal drug markets. It makes it easier for patients to get the medical treatments they need. And of course, it can bring in a lot of tax money. So the conversation is shifting from avoiding something illegal to understanding how to navigate something that's legal but still has risks. Let's put this into perspective. Just look at this chart. Alcohol is legal, tobacco is legal. Are they safe? Absolutely not. We know they come with serious health risks. Cannabis is now legal in many places, but its safety isn't a simple yes or no. It completely depends on the context. If you remember one thing from this, it should be this: legal does not equal safe. And that leads us right to the final medical verdict. Cannabis is not a miracle cure. And it's not some harmless plant you can just mess around with. It is a drug, a powerful substance that has the ability to help and the potential to harm. And like any drug, it demands our respect and our knowledge. So, after all this, is cannabis good or bad? The real answer is, it depends. It totally depends on who is using it. Are they a teenager or an adult with a medical condition? It depends on why they're using it. Is it for fun or is it prescribed by a doctor? And it depends on how they're using it. Is it a measured dose or an unknown amount from who knows where? So, the next time you hear someone dismissively say, "Oh, it's just a plant," maybe just pause for a second. Think about everything we've looked at, and then you can ask them a simple scientific question back. Would you really trust your brain to just a plant? That's a thought worth holding on to.